Let's talk about. I want us to talk about critical thinking, right? A lot of students don't understand when they say you should critically think. Now, I will tell you 100%, right? The way you think about critical thinking, right, is not the way you should be thinking about it. Now, let me tell you something. A lot of students struggle and how are you thinking about the question? Right. It all come from what? A foundation. You cannot just see mango growing on a particular tree and start saying what made what it a mango tree. Obviously, you need to know the seed that was planted was what? A mango seed, right? Same with oranges as well too, right? All these things you don't need to think about it because one, you understand the foundation, which is mango seed was planted and the result is what? A mango tree. Orange seed was planted and the result is what? Orange tree. But guess what? A lot of students have failed themselves from the foundation. So they don't even know the foundation and they are speaking nothing from the surface. You can never be a critical thinker because what are you using to critically think? Critically, to in order to critically think, I mean, right? You need foundation in order to critically think. One, you need to understand what area are you directing your thinking towards, and also what are the foundational knowledge of what you're about to what think. All right, I will give you few things. I just hope this video helps somebody. I definitely believe it should, because most of these things are not said in nursing school, right? I had to figure it out myself, right, in order to help me succeed. Now, this is it. And I'm trying to do this to help students as well, because a lot of students still struggle with critical thinking on the NCLEX as well. Now, this is it. There's two aspects to nursing. One, internal care. Two, external care. I don't know if this exists, but this is my theory. Now, internal care involve what? The physical state of the client. Let me put state in front. The physical state of the client. External care involve the ethical aspect of a client. I know nurses know about this, but what I'm not sure is if you know it's internal care or external care, because this is my thinking. Now, internal care involve treatment, medication, procedure, right? Everything possible to make sure that the patient is what? Stable, right? But external care don't involve all that. External care involve client rights, needs, confidentiality, privacy, ethical aspect, like everything related to the ethical aspect of a client. You don't treat here, you don't do procedure, you don't give medication. That's not what we do in external care. So now, when I say a particular question on the NCLEX exam, I can easily identify if that question is related to the external aspect of nursing or the internal aspect of nursing. But now, the biggest part of the NCLEX exam involve what? The internal aspect of nursing. The external aspect of nursing is something that you need to be careful with, right? Not to harm the client and also not to lose your license. But uh the external care is more of losing your license. It's more of you doing us. But the internal care is more of the client, making sure that they are stable, making sure that nothing is wrong with them. So this part you will get it the most on your exam. But now the problem is a lot of students think critical people that critically think they are, maybe there's a magic behind it. No, there's no magic. The aspect of critical thinking, right, all come from what? The foundational knowledge. But that foundational knowledge all come from what? Understanding that particular question. Now, let me give you foundational knowledge. Now, internal, as I said, external care involve what? Ethical guidelines or ethical aspect of the client, right? But internal care involve the physical state of the client. So, what make up the physical state of the client? One is the body, Right. Because for a client to be stable or anything that want to affect the client, it affects the body. Right. You see a particular client right now and you say, what's wrong with you? You don't look okay. Because you've seen the way the patient is behaving and then you feel like this patient is not what? Okay. Now, as a nurse, you do further assessment. Maybe you do head to toe assessment whereby you assess every body system and then you figure out, oh, a particular body system is having problem. Now, the body leads to what? Body system. Now, that is the next one. What make up the body systems? Cells. But NCLEX is not really going to bother you on this. Now, let's focus on this. Because we are trying to make sure that a client is what? Stable. And what make a client stable is that the 10 body system that we have are working effectively. Now, let me tell you the truth right now. If you ask 90% of nursing students to list the 10 body system, they can't. If you even see 10% of students listing it, trust me, they will still be struggling to list the body system. So, how do you comfortably care for the internal aspect of the client when you don't even know the basic? This is the basic of care. You need to know the body system and what? Anatomy. Right. If they ask you, like, you need to know the anatomy, you need to know vital organs as well too in the body. Because now if they ask you now, the neurological system, you need to like say the function, how it work. The moment you know how each of these body system work, trust me, when NCLEX is giving you a particular question and they are telling you about a client situation, you will be able to trace back what is not working. Am I making sense? It's just like now, a person that repairs phone, right? Maybe a damaged phone, only knows how to repair the phone because they have studied about the phone. They have learned about the phone. They know about the engine or anything in the software or something like that. Right. So they only know how to repair the phone because they know about the phone. If they don't know about the phone, guess what? When you come and you complain and you say, oh, I tried to turn on my phone, it's not on, they cannot really pick out what is the problem. Same as a nurse. If you see a particular question on the NCLEX exam and you are still lost in that particular question and the question is related to internal care, there's a big problem. It means that the foundation is not there. So how do you act like a nurse when you don't even understand the body system? You will be lost. I see no reason why you should be taking the NCLEX exam. I see no reason why you should be taking the NCLEX exam. Then you say everything is overwhelming. Why will it not be overwhelming? You don't know the foundational knowledge. You barely know the 10 body system. You barely know anatomy. Now, let me tell you something. NCLEX don't require you to know as much as you know in nursing school. I'm happy for you that you are done with nursing school. I'm so glad. So right now, you don't need to even focus on a lot that you did about body system, a lot that you did about anatomy. You just need the most important thing that you can use to evaluate your client to make sure what they are stable. So now if NCLEX is telling me, oh, a client is confused, restless, what am I thinking? Because I understand the 10 body system, I know that the neurological system is affected. If tomorrow NCLEX, maybe I see a particular NCLEX question and the question is talking about patient is dizzy, right? I will be thinking about this patient is dizzy. It can be a sign of the cardiovascular problem or something related to the neurological system, because those body systems are in charge of dizziness. How am I tracing all these things? Because I understand how the body system work. It's not magic. This is what we call critical thinking. If I see a particular question and then they are telling me a patient has not have bowel movement for a long period of time, what kind of question am I asking this patient? Are you eating? If you are eating, what kind of food are you eating? Do you drink fluid? Are you on any particular medication? Because this critical thinking all come from what I know. I know there are some certain medication that can cause constipation, because now they said they don't have any bowel movement, right? Now I know bowel movement is related to what? Maybe the patient is not eating, so obviously they are not eating what you expect to come out from the body now. Or maybe they are eating some certain kind of food that it take long time to what break down. Maybe they are not having sufficient fluid. Maybe they have they are taking medication that cause them to have constipation. Then Some people have constipation with what? Sign and symptom. Then I'm going to be asking related sign and symptom. Do you feel this kind of way? Do you have any like access for distension, pain, abdominal pain, distension, all that kind of stuff? Bowel sound. Why are these things coming to my head? Because I understand one particular thing that is related to constipation, which is the GI. So if I don't understand the GI and the patient is complaining of no bowel movement, I have no idea of what to think. So if you don't understand the GI and they are telling you a patient is having constipation, you cannot think. Now, let me tell you something. When you are reading 2,000 worth of information, I only do 10 body system, because 10 body system give me that advantage to answer 200 worth of information. I don't need to go and be studying 200 worth of information. I've never done that. The moment I understand, right, or I understood that the 10 body system is what creates all this problem, that is when I noticed that it's not about all this problem. It's about knowing the body system. Right, because there are a lot of things tomorrow NCLEX can tell you a patient feel pain on their right side, right lower quadrant. Right, anatomy is going to make us figure that out, in a sense that we are thinking about, okay, what is the structure that we have in that area, and let us start thinking why they could be having pain. Now, if you find out left lower quadrant, right, what you have right there is the appendix. True of us. Sorry, I said left lower. Right lower quadrant is the appendix. Right. So since it's the appendix, now I know about appendix, right? I know what it can cause. Then I'm thinking about, hope there's no what? Rupture, all that kind of stuff. So I know the next assessment to do. All this thinking, which is known as what? Nursing critical thinking, all come from foundational knowledge, which one I was able to figure out the kind of pain the patient might be having, because I understand what will be there due to what? Anatomy, right? And then I will also know about the GI. So I've learned so much about appendix, and I can easily tell what the patient might be experiencing with it and the complication they can also get. That way, all these things that I'm telling you, right, because I'm about to end this video, all these things I'm telling you, right, on the NCLEX exam, we help you to answer prioritization question. See how that good knowledge will help you out. Prioritization, it will help you to answer acute and chronic condition question. It will help you to answer intervention related question. It will help you to answer reduction of risk question on the exam. Which other ones? Prioritization. Yeah. So yes, these are things it will help you answer. Now, and all these things can give you at least 30 to 39% knowledge of what you need to know on the NCLEX exam. Now, imagine just only one thing you study, which is what? The 10 body system, learning the anatomy of the body. All you just need right now is to understand the area, the brain, like everything about the body system. Like, you want to understand each body system, starting from neuro down. You also want to know the priority body system, because that's very important. You want to know, I'm trying to say a lot because I have a class right now, so I'm just trying to like rush everything. Let me slow down a bit. Right now, you need to know the priority body system, like the most important body system, right? So you need to know them like level of priority, so that you can be able to think. Right, if a patient is having this symptom, what body system is affected? A lot of students cannot even link a particular symptom to a particular body system. That's a problem. So I always used to tell my students something. I said, if you see, right, a particular question and you cannot be able to relate to why the patient is experiencing that thing, then you are not ready to take the NCLEX exam. It's not possible. Every NCLEX question, you are familiar with it. The problem is that you have not fixed one thing, which is the foundation of how you process your studying. Right, you don't need 200 disease condition. I see most nursing guru like giving you printout PDF for 200 disease condition, 300 disease condition, 500 medication. No, that is senseless to me. Right, the moment you can know foundation, you will be able to print out all this knowledge of everything you need to know in nursing. So this is where I'm going to stop. Right, if you need help in maybe you want me to coach you In nursing school, I do that, and as well to help students pass the NCLEX exam. I've been doing that for the past 2 years. I have helped over 700 plus students to pass the NCLEX exam successfully, right? And I want you to be part of that number. If you need help to pass the NCLEX exam, reach out to me. +1767 613 0769. So text me, right? Text me. I'll be able to help you out in passing the NCLEX exam. I'll be able to help you out to figure out what nursing. Nursing is not difficult, right? It was difficult for me semester 1, semester 2, semester 3, but semester 4, semester 5, when I started understanding that I was skipping process because I needed to start from scratch. But when I finished a particular semester, I avoided this. I was trying to figure out the next semester, not knowing that everything connects each other. Everything in nursing connects each other. Forget the fact that they are all separated. They are one, because everything all work together to care for just one client. And client have what? Two aspects of care: the internal care, external care. So when I'm seeing my NCLEX question, I'm asking myself, am I doing internal care or am I doing external care? That way I can start picturing what? The foundational knowledge. NCLEX nursing is not difficult. Don't give up. If you are watching this video, this is a sign to you not to give up, because I'm going to help you out, right? I'm definitely going to help you out, because this is how you think about it. You are not caring for nothing else than what? 10 body system. You are not caring for 10 clients. You want to have understanding of 10 body system to be able to care for thousands of clients. That is how nursing is, right? So the moment you understand this body system, the most important thing about this body system, the symptom that they all scream out when they are in problem. Trust me, when you see a clear question, you'll be able to think. You'll be able to know what is priority. When I see people trying to put one or two strategy to answer prioritization question, I know the problem instantly. It's the foundational knowledge. Let it make sense to me, right? You have a patient that have no bowel sound, and you have a patient that have no bowel movement, and you are still trying to think about which of this is a priority. Now, answer this question. I know right now I cannot get feedback from you, but try to answer this question. Ask yourself, which of this is a priority? If you have, I've seen this on the NCLEX exam, whereby the NCLEX asks, who are you going to see first? A client who have no bowel sound and a client who have no bowel movement. So try to answer this question. Now, if your answer is this, congratulations, right? But if your answer is this, then you need help, right? You have to reach out to me, right? This is my number on the screen. Reach out to me. You need help, because you cannot go like that on the NCLEX exam, because this question right here, you should not be getting it wrong. If you are taking the NCLEX exam and you are getting this wrong, there's a big problem, because if you are getting this wrong, what will happen if NCLEX start advancing in those top critical area, which is your neuro, your cardiovascular and respiratory? Then there will be a big problem, because no bowel movement is not life threatening. It can cause discomfort, but it's not life threatening. But no bowel sound, it's just like now if they tell you the patient is not breathing. Are you thinking with me? A respiratory problem, and then they tell you the patient is not breathing. Are you not going to be concerned? The patient is not breathing. The patient is not breathing. You start CPR because the patient is not what? Breathing, right? Now, think about it related to this as well too. How do you know that the GI is working effectively? Obviously, when there's bowel sound. You can have low bowel sound or high bowel sound. It can be hypo or hyper. But if the NCLEX is not saying no, like there's no active bowel sound, like there's nothing at all, it's not low, it's not high, then there's a problem. Like a patient that's having respiratory issue, respiratory can be low, respiratory can be high. At this point, we are concerned, but you will be more concerned even when when you hear the patient have no breathing. Patient is not breathing at all. There's a problem. So now how the patient is having no bowel sound, it means there's a problem. How will the food move? How will everything? There's a big problem. Unlike no bowel movement, in as much as there's bowel sound, everything is still fine, right? So it all come down to what? Understanding what the body system. The moment you understand the body system, you know things that are critical and things that are not, right? So when you start seeing your NCLEX question, this critical thinking come in place, right? You are definitely going to be a nurse, and you will be a nurse, right? If you need someone that can push, that will push you, right, in order to succeed, right, I don't care if you fail the NCLEX exam multiple times. I've seen a particular student, I keep saying it, to fail the NCLEX exam 14 times and she succeeded. Right. Ever since then, this has been my motivation. I'm definitely going to make more students pass the NCLEX exam, and you are going to be part of the number. So reach out to me, right? Reach out to me.